Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the deep muscles of the back of the leg. So we have four deep muscles which are located in the back of the leg. These are the Popliteus, Tibialis Posterior, Flexor Digitorum Longus, Flexor Digitorum Longus, and Flexor Hallucis longus. Okay, so you got four muscles which are located in the deep aspect of the back of the leg. So out of this, Opitius muscle takes origin from the femur. Okay, this is the femur. Okay, the condyle of the femur. This is the lateral condyle. Lateral condyle of the femur. And this is the muscle, the Popliteus. Okay, we got the Popliteus muscle. Then we'll get the Tibialis Posterior muscle. Tibialis Posterior. We'll get the Flexor Digitorum Longus muscle. This is the Flexor Digitorum Longus. Okay, Flexor Digitorum Longus. And this is the Flexor Hallucis Longus. Flexor Hallucis Longus. Okay, so before going in details, let's get some facts. Popliteus muscle is the top here, and it takes origin from the lateral condyle of the femur, the lateral aspect. Other muscles does not take origin from the femur. These are from the tibia or fibula, or from both the tibia and fibula. Suppose Flexor Digitorum Longus takes origin from the tibia below the soleal line. Above the soleal line we have the Popliteus. We have the Tibialis Posterior muscle, the deepest muscle, that takes origin from the tibia and fibula. These are all posterior aspect of tibia and fibula, because we are dealing with the deep muscles of the back of the leg. Then Flexor Hallucis longus, it mostly takes origin from the posterior aspect of the fibula, except lower part from the interosseous membrane. From the interosseous membrane we will also get origin of the Tibialis Posterior. Tibialis Posterior takes origin from tibia, fibula and interosseous membrane. These tendons, these three muscle tendons, they should go behind the medial malleolus. Okay. So this is the medial malleolus. So the muscle should go behind the medial malleolus. Then this is the medial malleolus of the tibia. Okay. Then what happened? And just below the medial malleolus of the tibia, and in between the tibia and calcaneum, there is a flexor retinaculum. Tendon passes underneath the flexor retinaculum. Then it goes to the sole. Okay, so let's start one by one with Popliteus. Popliteus muscle first, and one common point is that all the muscles are innervated by the tibial nerve, and tibial nerve is a branch of the sciatic nerve. Okay, so we'll go from Popliteus. What is the origin of Popliteus? Origin is from the lateral surface of the lateral condyle of the femur, lateral surface of the lateral condyle of the femur. Okay, this is one origin. Multiple origin. It also takes origin from the arcuate popliteal ligament, from arcuate popliteal ligament. Okay, another origin is from the outer margin of the lateral meniscus, outer margin of the lateral meniscus. Meniscus is a fibrocartilage plate inside the knee joint that act as a shock absorber. Is fibrocartilage. So these are the origin of the popliteus muscle. Insertion. So origin here, origin is tendinous origin. Remember that, tendinous. And intracapsular origin, intracapsular origin, capsule of the knee joint. That's contribution in the origin. Okay, we got that. So we got the origin of the Popliteus. Now we'll go to the insertion. Insertion. Insertion is posterior surface of the tibia above the soleal line. It is a triangular shape insertion. This is that, and our soleal line is this, our soleal line. So above the soleal line in a triangular fashion on the posterior surface of the upper part of the tibia, a bit medial. Okay, so we got the insertion of the insertion on the medial part of the upper part of the posterior aspect of the tibia above the soleal line. You must remember that, above the soleal line. So posterior surface of the tibia into the medial 2/3 of the triangular area. This is a triangular area above the soleal line. This is the soleal line. We got the insertion of the Popliteus. Now we go to the, we got in origin insertion. Now we go to the nerve supply. Nerve supply, like other muscles of the back of the leg, nerve supply is easy to remember. That is the tibial nerve. Okay, what is the root value? L4, L5, S1, L4, L5, and S1. We got the nerve supply of the Popliteus. We got the origin. We got the insertion. Now we go to the action of the muscle. Action, it unlocks the knee joint. It unlocks the knee joint. Okay, so it unlocks the knee joint, flexes the knee joint because it passes over the knee joint, so it should have action on the knee joint. So it flexes the knee joint. Then another function, that is, it protects the lateral meniscus. It retracts the lateral meniscus, so it prevents the lateral meniscus crushing. Okay, retract the lateral meniscus. So lateral meniscus does not crush due to the movement of the knee joint meniscus. Okay, we got the Popliteus muscle. Now we'll go to the Flexor Digitorum Longus. Okay, Flexor Digitorum Longus. Okay, so Flexor Digitorum Longus, it takes origin from the upper 2/3 of the medial part of the tibia above the soleal line. So this is our soleal line. Okay, so it should take origin from the upper 2/3 of the medial part of the tibia on the posterior aspect of the tibia below the soleal line. You must remember that above the soleal line we have the Opitius. Below the soleal line we have all the muscle. This is the soleal line, everything is below these three muscles. This is above the soleal line, so we have to draw it. So this is the soleal line. Okay, so we got that the origin is upper 2/3 upper 2/3 of the medial part of the posterior surface of the tibia. Remember, below the soleal line. Okay, we got the origin of the Flexor Digitorum Longus. Okay, this is the origin. This is the tendon of the Flexor Digitorum Longus that passes behind the medial malleolus and passes underneath the flexor retinaculum of the foot, then goes to the sole. Okay, so plantar surface of the distal phalanx of the second, third, fourth, and the fifth toe. Insertion. Plantar surface of the distal phalanx. You must remember that distal phalanx. We have three phalanx: proximal phalanx, middle phalanx, and the distal phalanx. So insertion, plantar surface of the distal phalanx of the second, third, fourth, and fifth toes. Okay, we got the insertion. You have to remember that its insertion is tendon. This tendon, it crosses the tendon of Tibialis Posterior in the lower part of the leg. This tendon crosses the tendon of the Flexor Hallucis longus in the sole. So this tendon crosses two other tendons. One is the Tibialis Posterior in the leg, and another one is the Flexor Hallucis longus in the sole of the foot. Okay, so we got that, the insertion. Also, we have to remember that this tendon here it gives rise to 4 tendon for the 4 toes, distal phalanx. Here it also gives origin to the lumbrical muscles. Here is the lumbrical muscle origin. Lumbrical muscles of the foot. Muscles origin. Remember, this is origin. We have 4 lumbricals. 1, 2, 3, 4. This red are the lumbrical, their origin. And also this tendon receives the quadratus planti muscle. Okay, quadratus planti muscle. Okay. So tendon is receiving the quadratus planti muscle. Tendon give rise to the lumbrical muscle origin. How many lumbrical? 4 lumbrical. Okay. We got the quadratus planti. Quadratus planti in the old book, it is written as Flexor Digitorum accessorius. Same as quadratus planti. That muscle is attaching to the tendon of the Flexor Digitorum longus. Okay, we got the insertion, we got the origin. Now we'll go to the nerve supply. Nerve supply is very easy. Tibial nerve. Okay, tibial nerve. What is the root value? Root value is S2, S3. S2, S3. Root value. We got that. So what is the action of Flexor Digitorum longus? It flexes the lateral 4 toes. So action. What is the action of Flexor Digitorum longus? Flexor Digitorum longus. So actions of Flexor Digitorum longus. We know that action means that when we pull the insertion towards the origin, we'll get the action. So it flexes the toes, flexes the lateral 4 toes. Okay, this one. It flexes as because it passes over the ankle joint. So it should flexes the ankle joint. Okay. Then you have to know that it maintains the medial longitudinal arch of the foot. It maintains the medial longitudinal arch of the foot. Okay, we got that. Then it stabilizes the toes during movement. Okay, stabilizes the toes. Okay, along with the action of the quadratus planti, also called Flexor Digitorum accessorius. We got the Flexor Digitorum longus muscle. Now we'll go to the Flexor Hallucis longus. Flexor Hallucis longus. Flexor Hallucis. So ultimately it should go to the hallux. That means it should go to the distal flanks of the great toe in the plantar aspect. So Flexor Hallucis longus. What is the origin? Origin from the fibula. So this is fibula. Okay. So this is the fibula here. Fibula. Okay. Here is fibula, and its origin is from the posterior aspect of the middle half of the fibula, including a part from the interosseous membrane. Okay, so it originates from the lower 3/4, actually, maybe half or 3/4 of the posterior surface of the fibula. Okay, lower 3/4 of the posterior surface of the fibula. Okay, posterior 1/3 of the fibula, except the lower 2.5 centimeter. Okay, not exactly at the lowest part of the fibula, and also partly from interosseous membrane. Lower part also takes origin from the interosseous membrane. Okay, the lower part mostly from the shaft of the posterior surface of the shaft of the fibula. Okay, we got that. So origin, insertion. Insertion is very easy to remember. Insertion to the distal phalanx of the plantar aspect of the great toe. Okay, distal phalanx of the plantar surface of the toe, of the great toe, Okay, we got that. Great toe. Insertion, plantar surface of the distal phalanx of the great toe. But we must know one important point, its relationship to that of the sustentaculum tali. This is the sustentaculum tali of the calcaneum. The tendon, the flexor hallucis longus tendon, passes underneath the sustentaculum tali tendon. Sustentaculum tali, bony extension, a groove underneath this. This groove is for the passage of the tendon of the flexor hallucis longus. Okay, so you must know that the tendon passes underneath the sustentaculum tali. This is the bony extension, bony prominence of the calcaneum. Okay, this is the sustentaculum tali. Tendon goes underneath it. Okay, we got that. We got the action of the flexor hallucis longus. Again, very easy to remember. We must pull the insertion towards the origin, then we'll get action. Okay, what is the action? It flexes the great toe. So plantar flexion of the great toe. This is one. Also, it passes over the ankle joint. It also flexes the ankle joint. Okay, so it flexes the ankle joint. It also helps in the maintenance of medial longitudinal arch. Maintains the medial longitudinal arch of the foot. Longitudinal arch. Medial longitudinal arch of the foot. Okay, we got that. The functions or actions of the flexor hallucis longus. Now we go to the tibialis posterior. Tibialis posterior is the deepest muscle in the back of the leg. tibialis posterior. The deepest muscle in the back of the leg, in the back of the leg. Okay, we got the tibialis posterior. Okay, now what is the origin? Again, origin is from the tibia and fibula. Upper 2/3 of the lateral part of the upper 2/3 of the lateral part of the posterior surface of the tibia, posterior surface of the tibia. Okay, certainly below the soleal line. Okay, so we got that. This is the soleal line. Here we'll get the origin of the tibialis posterior here. Okay, from here, lateral part, medial part, we have the origin of the flexor digitorum longus. We got the origin of the tibialis posterior, and also it takes origin from the posterior surface of the fibula, where posterior surface of the fibula in front of the medial crest of the fibula. Okay, and also it takes origin from the interosseous membrane, posterior aspect of the interosseous membrane. Okay, we got the multiple origin from tibia, fibula and interosseous membrane. Insertion, or we got the origin, these are origin. We'll go to the insertion. Insertion, most important insertion to the tuberosity of the navicular bone. This is the tuberosity of the navicular bone, but this is not the only one insertion, it is multiple insertion. So, tuberosity of the navicular bone. Okay, then all the tarsal bone except the talus. So talus is a bone without any muscle attachment. Okay, so all the tarsal muscles except the talus. Okay, then it also inserts the second, third and fourth metatarsal bone. Okay, second, third and fourth metatarsal bone. It gives insertion there, metatarsal bone. Okay, and right here inserts to the second, third and fourth metatarsal bone. Okay, it passes underneath the flexor retinaculum again, and it is related to the spring ligament. Spring ligament is the plantar talocalcaneonavicular ligament that is very essential to maintain the arches of the foot. Okay, so we got that the Tibialis Posterior, origin insertion. Insertion to many bones, okay, with the exception talus and also the first metatarsal bone. It inserts all the tarsal bones, okay, and also second, third and fourth metatarsal bone we got the insertion. Then it's nerve supply. Nerve supply, again very easy to remember, tibial nerve. But here we have to know its root value L4, L5, L5 and S1. Okay, root value L4, L5, S1. Okay, tibial nerve innervating the tibialis posterior muscle. Okay, so what is the action of this muscle? Action or function? Action of the tibialis posterior. Action, it is an inverter of the foot. Inverter of the foot. And we know that inversion take place in the subtalar joints. Okay, and powerful plantar flexor. It is a powerful plantar flexor. There is another function. It maintains medial and transverse arch of the foot. Maintains medial and transverse arch of the foot. Okay, we got that. Muscles action, origin insertion, nerve supply action, blood supply according to its location. They will get blood supply from genicular artery, especially this muscle. They will get blood supply from the posterior tibial artery, from the lateral medial plantar artery here to the tendons. Okay, and we got the soleal line. Above the soleal line, this is our soleal line is here. Above the soleal line, we have the Popliteus. Below soleal line, we have the Flexor Digitorum longus, Tibialis Posterior, Flexor Hallucis longus. Flexor Hallucis longus mostly takes origin from the fibula, posterior part. The Tibialis Posterior takes origin from both tibia and fibula plus interosseous membrane. Flexor Hallucis longus also gets some insertion from the interosseous membrane in its posterior part. Okay, this tendon, the tendon of tibialis posterior, is crossed by the tendon of the Flexor Digitorum longus. Flexor Digitorum longus also crosses the tendon of the Flexor Hallucis longus. Flexor Digitorum longus tendon also receives the muscle quadratus planti. Old name was Flexor Digitorum accessorius. The tendon will give origin to muscle, the lumbrical muscles. So these are all lumbrical muscles. This is the lateral condyle of the femur. This is the site of origin of the Popliteus muscle. So that's all about the deep muscles of the back of the leg. If you like my video, please support my channel. Please subscribe me. Share the information with your friends and have a nice day. Bye now.